Hi, everyone. My name is Patty Welch, and I'm presenting on findings and recommendations from a qualitative research study that was conducted in Borno State, Nigeria, looking at barriers and facilitators to accessing quality care along the MAMI Care Pathway. Why is it important to focus on adolescent mothers within MAMI in Nigeria? We know that adolescent mothers have worse perinatal care seeking practices in Nigeria compared to adolescent mothers, including a lower prevalence of attending ANC, giving birth with a skilled provider, and receiving a postnatal check within 2 days of birth. They also have worse maternal and newborn nutrition growth and outcomes compared to older women. In Borno State, Nigeria, adolescent mothers have a 62% higher prevalence of having a low birth weight baby compared to older mothers. They're over twice as likely to have short stature and underweight, both known risk factors for having a premature and/or low birth weight baby, and they have twice the prevalence of acute malnutrition compared to older mothers. The primary objective of this formative research study was to understand the barriers and facilitators to adolescent mothers' use and non-use of health and nutrition services along the MAMI Care Pathway. The aim of the study was to inform the design of adaptations to the MAMI Care Pathway to improve the reach and responsiveness of MAMI to adolescent mothers and their infants under 6 months. Because we wanted to try to understand factors not just surrounding an adolescent mother's experiences when she's enrolled in the MAMI Care Pathway, but also those factors which may affect referral into the care pathway, we explored factors affecting uptake of services across the continuum of care from pregnancy through the postnatal period. This work was funded by the Church of Jesus Christ of Latter-day Saints. This study used qualitative methods for data collection, including in-depth interviews, focus group discussions, and key informant interviews. In addition, pregnant adolescents and pregnant adolescents with an under 6-month infant enrolled in MAMI and those not enrolled in MAMI, key influencers of these adolescents, male partners and older female relatives were included, in addition to community and facility-based health providers who support MAMI programming. The study took place in Matha, Kanduga, MMC, and Jerry local government areas. 4 health facilities, 1 in each LGA, were included. The communities of these facilities include internally displaced persons, host community members, and urban and rural settings. The study approach was guided by the social ecological model to help better understand the range of personal, interpersonal, community, and structural factors affecting care for pregnant adolescents and adolescent mothers, and to validate our findings and support a collaborative process to co-create proposed recommendations. 2 validation workshops were held with adolescent mothers. The barriers are organized along the 4 constructs of the social ecological model. Starting at the individual level, adolescent girl and male partner participants express perceived judgment and/or fear of persecution as a pregnant adolescent by community members, including health workers, as a key barrier. Mental health challenges associated with being a young first-time mother, particularly in a context of conflict, and one where she's of a low socioeconomic status, was noted as a barrier to uptake of care. Negative perceptions of the quality of care at the health facility, availability of bed spaces and essential medicines, and attitudes of health workers was reported as a barrier by many adolescent girl participants. In addition to these barriers, participants reported that trust in traditional birth attendants and elderly women as a source of care and advice remains strong. And because of this, many pregnant adolescents choose to deliver with a TBA rather than at the health facility and seek advice and counseling about health, nutrition, and caregiving from elder women rather than health workers. A lack of experience with how to navigate the pre- and postpartum periods and related health and nutrition services as first-time mothers was reported by CHWs and facility-based health providers as a key barrier that many pregnant adolescents and adolescent mothers face. At the interpersonal level, the influence of family and community members was reported as a key barrier to seeking health and nutrition services. Older female relatives often serve as gatekeepers to health services in the study setting and were reported to commonly dissuade pregnant adolescents and adolescent mothers from seeking health services along the continuum of care. Participants expressed that male partners as the head of family may prevent pregnant adolescents and adolescent mothers from accessing health services. And both CHWs and facility-based providers expressed more challenges with providing care to adolescent mothers compared to older mothers. They reported that pregnant adolescents and adolescent mothers often conceal information about their pregnancy or about themselves and their infant postpartum. They're more shy and less likely to be engaged during health service visits, and they're less likely to follow recommended feeding and care practices as compared to older mothers. At the community level, stigma against adolescent pregnancy and having an underweight or ill infant was reported as a key barrier, negatively impacting pregnant adolescents and adolescent mothers from accessing quality care. This stigma contributes to neglect, shame, and discrimination by our family and community members, which includes health workers, resulting in the adolescent girl staying in the home for much of her pregnancy to avoid such discrimination and preventing her from attending health services. And lastly, at the structural level, the financial cost of health services and/or transportation and accessibility were reported as key barriers by participants. Although MAMI services and services at public health facilities are free of charge, they're often not located in the adolescent girls' communities, and transportation is necessary and costly. Both adolescent girls and older female relatives voice concerns about judgmental, disrespectful, and non-compassionate care that adolescent girls experience from some health workers, especially during pregnancy. Moving on to facilitators, at the individual level, the desire to keep herself and her infant healthy was reported as a key facilitator for pregnant adolescents and adolescent mothers. The belief that attending health and nutrition services is necessary to keep mother and infant healthy was expressed as another key facilitator. Perceived sickness and/or malnutrition of the mother or her infant during or after pregnancy was reported as a facilitator to seeking health and nutrition services. And of note, this can also serve as a barrier to attending services if the mother does not understand the importance of attending routine health services outside of perceived illness and malnutrition. At the interpersonal level, having family, partner, and/or community support to attend health and nutrition services for her and her infant was reported by adolescent girls as a significant facilitator. Hearing about the positive experiences of other mothers in their community in the MAMI program or other health and nutrition services was another key facilitator. At the community level, receiving support from peers or other community members and/or encouragement around child rearing, emotional needs, and/or attending health and nutrition services was a facilitator. And at the structural level, accessibility and close proximity to health and nutrition services was highlighted by adolescent girl and male partner participants as a key facilitator. If the health services are located in her community, she's likely to attend. And low and or no cost health services was also expressed as a key facilitator. And many adolescent girls and male partners reported that they were able to attend MAMI services and other services in the community and at public health facilities because they're provided at no cost. And linked with the above facilitator on accessibility, partners reported not having to pay transportation fares to access health and nutrition services because they're located in or near the community was also an important facilitator. Receiving respectful, non-judgmental, and quality care from health workers was highlighted by adolescent girls and male partners as a significant facilitator to the adolescent girl attending services. Receiving a MAMI hygiene kit was also reported as a key facilitator to attending MAMI services. In Nigeria, due to reported suboptimal attendance during MAMI follow-up visits, Save the Children began providing enrollees with a MAMI hygiene kit as an incentive to continue attending MAMI, and study participants enrolled in MAMI reported this as a facilitator to them attending services. These findings help shed some light on some recommended areas of adaptation and program improvements for MAMI. The first of these recommendations is to strengthen the capacity of health workers, including through training them on how to provide respectful, non-judgmental care to pregnant adolescents and adolescent mothers, and also through adding a session to the MAMI training package on adolescent-friendly services. It's important to strengthen linkages in the health system to MAMI to support referrals, including from services that adolescents are likely to access. This may vary across contexts, but in Northeast Nigeria, this means creating linkages between TBAs and MAMI, for example. To improve adolescent reach to this traditionally harder to reach population, programs can expand community-based MAMI programming. Consider home visits for adolescent mothers, and as able, CHWs might accompany pregnant adolescents and adolescent mothers to the health facility, as this was reported as a key facilitator. Update the MAMI Care Pathway tools and materials to reflect the age of the global standard for adolescents to less than or equal to 19 years instead of less than 19 years. Adolescents are currently defined in MAMI tools and materials as less than 19 years, which does not align with the WHO definition of this age group. And this may lead to unintentionally excluding some adolescents who would otherwise qualify for enrollment. And it could also lead to inaccurate program monitoring and coverage data. Increasing community awareness among pregnant adolescents and adolescent mothers and those who serve as key influencers to them of MAMI. The importance of attending services routinely for prevention and not just when visibly ill. How to identify risk factors for themselves and their infant, and also where to access services. This awareness raising should ensure adolescent mothers are aware of MAMI during pregnancy and the importance of enrolling immediately following birth to support the mother's and infant's health and development. Providing peer support to pregnant adolescents and adolescent mothers is a key recommendation. This could include an adolescent mentorship program and adolescent-specific mother-to-mother support groups. Previous research has shown us that adolescent mothers are less likely to attend mother support groups as they view them as not being relevant to them or tailored to their needs. So adolescent-specific support groups can help to address this. Additionally, include in support groups messaging on recommended health service contact points during pregnancy and postpartum periods. Programs should aim to strengthen services to improve support for adolescent girls' mental well-being, both within MAMI and beyond, including through increasing the adolescent friendliness of MAMI mental health and psychosocial screening, job aid, training, and monitoring tools, increasing the number of healthcare workers trained in providing MHPSS to adolescents, and integrating context-informed MHPSS messages through MAMI, IYCF, ASRH, and other health activities to support the well-being of all mothers and inform them where to receive additional support. And lastly, it's important to engage household members to support adolescent mothers to attend MAMI services and other health and nutrition services along the care pathway. That concludes our presentation. Thank you so much.